companies that focus on communications about migraine. And a lot of coalitions are just nonprofit organizations. But when CHAMP was created, the decision was made that we wanted to have the smartest patient minds that exist participating in this. We wanted to have the biggest megaphones. So being able to have organizations like Migraine.com and Migraine Again be part of this. They bring their smarts to the discussions of the coalition. And then when the coalition decides to get behind something and promote an initiative, they help us to do that. And so it's really wonderful. Without further ado, we will go ahead and jump into our first one, which is going to be Marcia Kuvulich, who is with Migraine.com. And so Marcia, take it away.
Thank you so much, Kevin. Everyone, welcome back. And I hope you're all having a safe and gentle Saturday. Like Kevin said, I am the Senior Director of Community Development at HealthyWomen and Migraine.com. Back in 2010, HealthyWomen was founded by Olivier Chateau and Tim Armand as they saw the untapped potential of leveraging technology to allow people with chronic conditions to learn, connect, and share in impactful ways. For the last 10 years, Migraine.com has been inspiring people living with migraine to embrace their whole selves. Our content and engagement strategy efforts translate into meaningful health conversations and interactions that allow for opportunities to form relationships in this incredible community. We publish original daily content from our patient advocates, which are shared in weekly newsletters and on our social media channels. We also welcome community members to share their own stories, ask questions, and hear from one another based on where they are in their migraine journey. Topics range from diagnosis challenges, finding a doctor who listens, coping with the stigma faced in the workplace, or from loved ones who don't understand that migraine is simply not just a headache. We also share information on treatment options and connect people with each other to hear about their experiences trying their different migraine treatment options. This can be especially useful not only for people with migraine and other headache diseases, but for their caregivers or loved ones, as well as their colleagues and maybe even their professors, to read and understand just what people are facing living with migraine. 10 years later, HealthyWomen currently has 27 condition-specific online communities with the main focus of meeting people where they are in their journey. Some examples of our other online communities serve people living with rheumatoid arthritis, multiple sclerosis, type 2 diabetes, asthma, endometriosis, Parkinson's disease, blood cancer, lung cancer, advanced breast cancer, HIV, and lupus. Across all of our communities at HealthyWomen, we prioritize giving people what they want and curating a safe space that is free of judgment and stigma. And I would just like to add that my favorite part of working on Migraine.com for the last 3+ years is in real time seeing people connect with one another, watching someone say that they're feeling desperate or feeling alone and isolated, and watching someone else in the community reach out to this stranger and lift them up and make them feel less alone in the fight in living with migraine.
Wonderful. Thank you so much for that, Marcia. And we're going to next go into our next member, which is Migraine Again. And we have Angie Glazer here.
Hi, Kevin and
Hello.
Chia.
Hello.
Hi, thanks for having me. I'm very happy to be here this morning. As Kevin said, my name is Angie Glazer, and I'm a senior editor at Migraine Again. Migraine Again was founded in 2014 by a lifelong migraine warrior, Paula K. Dumas, and her husband, Carl Dumas. I came on board a couple years later in 2016 after Paula discovered a blog post I wrote about applying for disability because of chronic migraine. At Migraine Again, we are by patients for patients. That means that everyone on our team lives with a headache disorder. Paula lived and worked with chronic migraine for years and is thankfully now back to episodic migraine. I currently have chronic migraine, while our editor Sharon Murray, our community support lead Claire Simmons, and everyone on our team of writers also lives with migraine or cluster headache, or both. Our goal at Migraine Again is to provide you with patient-led, doctor-backed advice, info, and tips so you suffer less and live more at home, at work, at school, in your relationships, and beyond. In 2018, the Daily Migraine joined our family, along with the highly active and engaged private support group on Facebook. Earlier this year, Migraine Again was acquired by Everyday Health, a digital content producer based in New York City. Everyday Health is one of the leading health publishers responsible for a number of impressive sites like MedPage Today, Mayo Clinic, What to Expect, and Baby Center. Everyday Health is helping us reach and help even more people with migraine, an opportunity that we are really excited about. So how can you get involved? There are 3 ways. First, register for our weekly Migraine Again newsletter to get tips and insights delivered directly to your email. Second, join the Daily Migraine private support group on Facebook to connect with like-minded people who will understand you. And thirdly, check out everydayhealth.com for all things health and wellness. Thank you again for having me, Kevin and Champ.
Wonderful. Thank you so much, Angie. And we will go into our next presenter, who is Wendy Baumfalk with the Migraine World Summit.
Hi, I'm Wendy Baumfalk. I'm the Director of Operations for the Migraine World Summit. I'm so glad to be here today. Thank you to Champ and RetreatMigraine for letting us be a part of this wonderful event. I got to attend in person last year and it was just terrific. I came across the Migraine World Summit about 3 or 4 years ago when I was really desperate in my own migraine journey and just got a lot of help from them and ended up coming on board about 1.5 years ago and have just had a wonderful experience. At the Migraine World Summit, our mission is to reduce the global burden of migraine. And the way that we do this is providing access to world-leading experts in the migraine and headache space. And we provide them to anyone who wants to watch from the comfort of their own home. We actually just wrapped up our latest Migraine World Summit. It took place in March. We kicked off our summit with an in-person event in New York City in early March, and we had a comedian, Whitney Cummings, an Olympic swimmer, and 3 experts come and talk to an in-person audience, which was wonderful to have that community building. And then our online summit kicked off on March 18th. We showed 32 different interviews across the course of 9 days, and you can tune in and watch for free during that 9-day period. After that, you can, if you'd like to, you can purchase a package, and we donate some of our funds to our nonprofit partners, and also some of the costs help with our production cost. But in terms of how you get involved, I should mention it takes a very big team, a very dedicated team to pull off the summit each year. This past year, we had 61 people on board on a total of 7 different teams, ranging from social media to technology teams to content teams to support ambassadors. I saw Brenda, I think, hi Brenda, was on today. So she was one of our ambassadors, which is awesome. And we represented 11 different countries. So it's a very global mission and it's a global group of volunteers as well. And we do a big recruiting push in the fall. So if you are interested in getting on board, we would love to have you. Like I said, big recruiting push in the fall, but we actually are always looking for talented individuals. In terms of kind of getting more information about the summit, there's a few things you can do here. You can go online and register, and that will give you access to our weekly newsletters where we give tips from our experts. If you are registered, you can actually watch the first 2 days for free. So you can go online and watch that now, but you can always watch previews of the interviews and see if you want to watch more of them. And of course, learn from these experts what the latest and greatest is out there. And then lastly, if you are interested in getting on board or coming on board to help us, go to our website. There is a link on there that says join our team, and we'll be updating it in the next few days with some of our ongoing needs that we have. So anyway, sure appreciate you, and thanks for tuning into the summit, and thanks for this time.
Great, Wendy, thank you so much. Our next presenter is Cami Rome with Migraine Disease Org, and we'll see if we can make this connection happen here because Cami is coming to us all the way from Germany.
As Kevin said, I'm the Executive Director of Migraine Disease Org, which was founded in May of 2018 by Terry Robert, myself, and my husband Brian. And we wanted to create a space where we could provide the kind of content that Terry and I have been writing for years for a variety of other organizations, and to be able to consolidate that in one place where everyone could find accurate, reliable, timely information So we created MigraineDisease.org, and you can go out there, visit the website, get free migraine education, download forms and letters, worksheets, and even trackers to help you monitor your symptoms, so that you can talk to your doctor about better migraine treatment. We are in a bit of a transition right now because Terry has retired and I have moved to Germany. So we are looking for more content creators, writers to join our team to help us keep the content fresh and timely for all of our readers. That's about it for now, but thanks.
And our last organization to present today is HealthyWomen. We have Helene Bader. Hello, Helene.
Well, thank you, Kevin, and thank you for inviting us to participate in this wonderful event. Well, I'm Helene Bader, as Kevin said, Senior Advisor of Education for HealthyWomen, and we are a nonprofit organization, an independent online health information source for women. And our mission is to educate, engage, and inspire women ages 35 to 64 to make informed health choices for themselves and their families. We've been around since 1998, and throughout those years, we've been providing objective, research-based health content on a wide range of diseases, conditions, and lifestyle issues. Women come to our website to find answers to a number of healthcare issues, questions, anything from reproductive health concerns to incontinence to bladder issues, topics such as endometriosis. And they're also looking for information on various mental health issues or chronic conditions that disproportionately affect women. We also work to educate women about health policy issues that affect women, such as access to affordable care, safe medicines, and competent healthcare delivery practices. And we have numerous ways to ensure we're delivering the most accurate information to women. So we do market research surveys, and we gain insight from consumers and healthcare professionals about specific topics. We use polls to get some quick answers from our audience about various health conditions. We interview women, and we share their stories through our Real Women, Real Stories feature. And we also have a highly engaged, proactive online community that we learn from as well. And we also act as a convener on a variety of topics. So we bring together women's health experts and healthcare professionals, patient advocacies, and policymakers to encourage dialogue. All of our content's medically reviewed, so we can be sure we're providing evidence-based information, and we also do a lot of collaborations. And a major area of interest for our audience for a while has been migraines and headache disease. So given that migraine disease is more common in women than men, and about 40% of women experience migraine disease, we consider it's a very important topic to address in our community of women. And personally, this is an important topic for me, as I suffer from headache disease, and a number of my close family and friends do as well. So we've had information about headaches and migraine on our site for years, but in the past few years, we've had an even greater focus. In December of 2018, we hosted a one-day meeting with clinicians and patients to discuss non-drug and non-invasive migraine therapies in women. Some of our CHAMP members participated in that meeting, which was great. We talked about availability and efficacy of non-drug treatments and barriers to the treatment. And we also had several women with migraine disease share insights into their own journey. And you can find this report on our website from the meeting. We also hosted a chronic pain summit last summer where migraine was a featured topic. So several of our CHAMP members attended and participated in this meeting as well. There's a link to the meeting and all the presentations on our website. And we also house all of our articles in an online migraine guide. So we cover various topics related to migraine in women, such as health insurance, access to medication, information for healthcare providers to help women. We have a fast fact sheets. We have a number of women's stories talking about real world perspectives of living with migraine disease and managing work with migraines. And we're currently working on more resources focused on migraines. So we have an interactive tool and some women's stories and an educational toolkit. And although our site does focus on a lot of issues, we do make sure we help women and help them get their condition recognized if they have migraine and they don't realize they do. So women find support and connect with each other through their stories, and we love seeing our community grow on our website. So we're happy to help share these tools with all of you, and you can find it all on healthywomen.org/migraine. So thank you.